Hello and welcome to Sports Medicine. My name is Miss Mariquin. I am the CTE Sports Medicine teacher here at Southwest High School. I'm also the Certified Athletic Trainer for Southwest High School. In addition to my teaching responsibility, I cover after-school athletic events as the Certified Athletic Trainer. Now let's talk about the sports medicine course that your student is enrolled in. Now, the sports medicine course is part of a patient care pathway, or what we're going to call here the sports medicine pathway at Southwest High School. This pathway is 3 years in length. The sports medicine pathway includes sports medicine 1, sports medicine 2, and sports medicine 3. Each level builds upon itself. In sports medicine 1, we lay the foundation. In sports medicine 1, we learn things like sports medicine careers, medical terminology, medical organizations, the skeletal system, the muscular system, how tissue responds to injury, and much more. Taking that information and building upon it, we have sports medicine 2, where we're going to go deeper and we're going to learn how to evaluate and rehabilitate injuries. In sports medicine 3, the curriculum is actually currently being adjusted. It's going to be formatted in more of an intern-externship kind of way. This sports medicine pathway is 3 years in length, but to be considered a completer of the pathway, you only need to complete 2 years, sports medicine 1 and sports medicine 2 in order. If the student completes sports medicine 1, both semesters, sports medicine 2, both semesters in order, and they earn a C or higher, the student will have earned a sash to wear to graduation at Southwest High School. Students in sports medicine 2, if they earn a B or higher in sports medicine 2, they're able to earn college credit. Sports medicine 2 is an articulated course that's articulated with Southwestern Community College. So we're learning material in class, and they're going to earn a grade for Southwest High School. But also, after completing some paperwork, they're also going to earn free college credit if they earn a B or higher in both semesters of sports medicine 2. So in summary here, there are 3 years of sports medicine available. But in order to be considered a completer, you only need to complete sports medicine 1 and sports medicine 2. If we want to earn a sash for graduation, we need to complete sports medicine 1 and sports medicine 2 in order with a C or higher. If we want to earn college credit while taking a sports medicine class, we need to pass sports medicine 1, hopefully with a C or higher. And we'll have to complete sports medicine 2 with a B or higher in order to earn that college credit. So keep that in mind as we move forward in the year. Now let's talk about classwork. Whenever we are doing something in class, material will be provided in the student's Google Classroom. If we have something like a lecture in class, I will also provide all the resources I can for that lecture. I understand that students learn in a variety of ways. Some students are visual learners, while others are auditory, reading, writing, or kinesthetic. So understanding that students all have different learning styles, I try to make sure that I include different resources in the Google Classroom for students to reflect on their own outside of class, if they want to, or even if they're absent. So, for example, for a lecture, I will provide an outline of notes if students want to use them as note starters. I will also provide the actual Google Slides that I present, just in case the student wants to review it on their own and they want to manually flip through it. And I'll also provide a YouTube video that is a recording of the actual lecture that I would have already given in class. So I've already pre-recorded all my lectures. So that way students are able to go back and listen to things if they need to. Again, students all learn in a variety of ways. They have different learning styles, and I try to make sure that there is something that connects with their learning style in the Google Classroom. In addition to things like lectures and presentations, we do have hands-on components in class. There are times where we will have to palpate ourselves or palpate our partner in order to find an anatomical landmark or to tape something or to evaluate something. Whenever we do have a hands-on component, I will demonstrate what needs to be done first, and I will supervise the hands-on components throughout class to ensure that everything is done properly. Whenever we are given some kind of task, a project, some kind of asynchronous work to do independently in class, class time is always given for the students to work with. I think that is going to be better than giving something and expecting the student to do it at home. If I give class time, I'm able to be there in the room with them just in case there's questions, comments, or concerns, so I can get them back on track to understanding so they can then go and complete the assignment. So if for some reason the student doesn't use class time wisely, they are going to end up with homework. But overall, there's really minimal to no homework that's going to be given from sports medicine. There's going to be one or two things that come up here or there. But if the student is constantly having a lot of homework being brought home from sports medicine, that's an indicator that they're not using their class time very wisely. Even though that there is minimal to no homework assigned, there's definitely a need to study at home. The things that we learn in class aren't going to be something that's going to be memorized or understood at first glance. It's going to take some review or practice. So if we have a lecture, it's smart if students can go back over their notes to make sure they understand it, or go back and watch part of the YouTube video they need more clarification on, so that way when they come to class the next day, they're able to ask questions that they forgot in between us not seeing each other. Whenever we have hands-on components in class, that may not be enough to understand. So I also encourage students to practice their palpation and testing and whatnot at home on themselves, or on somebody else that's willing to volunteer as their partner. About late work, again, plenty of class time is given for work to be completed, so there shouldn't really be any late work. But things do happen once in a while. So late work is accepted only one class period late. And what I mean by that, it can be turned in the next time we see each other. So if we see each other on Monday for class and the student forgot their work or did not turn it in on time, they're able to turn it in on Wednesday. So the next time we see each other, since we only see each other every other day. And that should be plenty of time because we do have that gap day between our meetings. Folder checks and tests, though, must be done on time. Folder checks are going to essentially just be all of the work that's done in the unit added up as one. So instead of submitting individual assignment grades into their Jupyter grades, what we do instead is that we go in Google Classroom, tally up all the points that they earned for that unit, and put it into that folder check section. So in their grade, you'll only see folder checks, test, projects, and finals. So that way it's cleaner to understand in Jupyter grades and Infinite Campus. But they can always go into Google Classroom and see their specific assignments, specific grades, and their feedback. And we want to try to make sure that we do our tests on the day of the test, that we're in class, so that way we can go over tests the following class period with everybody. If someone is absent, we're not able to really do that. So we're going to try to get those two things done on time. In addition to our hands-on components in class, there is an opportunity to shadow me as the athletic trainer after school. So in addition to my teaching responsibilities, I do cover after-school athletic events, and students are going to have the option to sign up and volunteer and shadow me throughout whatever day that they choose. And during that time, we're able to learn about whatever happens during that day, or we can review anything the student wants to learn, or we can just watch the sport and talk about things that could occur. But it's a great opportunity that students get a little bit more one-on-one time with me and also get to maybe see some actual injuries. These hours can be used as community service hours. So that's awesome because some of you still need your community service hours to graduate. If you're interested with the observation with me, have the student come talk to me in class and I will give them a packet, a little handbook for them to read. And then they'll have to turn in the consent and form that includes some other additional information that I collect just in case they get hurt while volunteering me. In regards to requirements for after school observation, see the current syllabus for requirements. The requirements for students to participate in observation hours changes depending on if we are distance learning, hybrid learning, or fully in-person learning. And it also differs between the levels of sports medicine. So please look at your syllabus if there's a requirement to do any observation hours. So for example, sports medicine 3, it is a requirement that we do have observation hours since it's an externship kind of class. Sports medicine 1, sports medicine 2, please reflect back to your syllabus because it's going to vary again depending on the type of school setting we have for the year. A few reminders here. Reminder number 1, we need to have laptops brought to class. Laptops are required for class. We are going to work primarily on the computer. Some paper assignments here or there because of the type of assignment it is, but we're going to need those computers brought to class daily. And also, let's bring those chargers because those computers need a charge at some point in the day. We also want to try to make sure that we remember to store our phones away during class. They could become distracting. Students look at them here or there is okay, but we have students sitting in the classroom typing on their phone behind their computer, and we're not keeping our focus on the lecture, and we're taking away the opportunity of learning from everybody else. So we're going to make sure those phones are stored away moving forward. Lastly here, attendance is super important and always is, but with the structure of the school day that we have right now, we only see each other every other day for about an hour and a half. So the course is going to move kind of quick since we only see each other 2 to 3 times a week. So missing a day is going to mean that you're missing a good amount of information. So being in class is going to be important. If something comes up, we do have Google Classroom. It will be posted in Google Classroom and students are able to go in and complete the work or see the material while they're at home. But of course, being in the classroom is going to be better so that way we can have conversations if there's some kind of misunderstanding or we need to do some kind of activity. Well, that concludes my open house presentation. If you have any questions at all, feel free to email me. My work email is on the screen here, and I'll be happy to communicate with whatever topic you want to talk about. I look forward to having an awesome year with you and your students. Thank you.